Okay, thank you for coming along. I've been joined by the Chief Health Officer to provide an update on the COVID-19 situation in Victoria. Unfortunately, our hard-working Auslan interpreters were unable to make it today. I apologise to the deaf community, but we'll make sure that those arrangements are reinstated tomorrow. We've also been joined today by a number of our recently arrived international healthcare professionals who, if it's okay with you, given the kids and their families that are here, what we'll do is I'll provide the initial update, then we'll ask our international doctors and healthcare professionals to come forward, say a few words. If we could then take any questions from the media to those people, let them and their families get about their business. Then the Chief Health Officer will give his detailed presentation on the map of the outbreak, and then we'll take questions if that's okay. So currently we've reported for yesterday 1,466 COVID cases in the Victorian community, all of which were locally acquired. This brings to 19,627 active cases of COVID in the Victorian community. Very sadly, 8 people lost their lives yesterday with COVID-19 in today's reporting figures. Those were a man in his 90s from the Hume area, a man in his 80s from Moonee Valley, a man in his 80s from Monash, a woman in her 70s from the Maribyrnong community, a woman in her 80s from Whittlesea, a man in his 70s and a woman in her 50s from the Moreland community, and a man in his 40s from Bayside. Can I take this opportunity to pass on our deepest condolences to those families, to the friends and to the communities of those people who have passed away. It's a difficult time, and our thoughts are with you at this tragic moment. Currently, we have 675 people in hospital with COVID, and of those, 144 are in intensive care and 100 are on a ventilator. Of the cases in hospital yesterday, just 7% were fully vaccinated. And given the high number of vaccinations throughout our community, the fact that so many were either partially or unvaccinated continues to speak volumes about the importance of being vaccinated to protect yourself and to protect your community and to keep out of hospital. In regards to tests and vaccines, 68,509 tests were processed yesterday. There were 36,383 vaccines distributed through state-run clinics, many more than that distributed through primary care, and well over 90,000 vaccines distributed again in Victoria as Victorians come forward in increasing numbers to be vaccinated. We are now at 86.7% of the 16 years and over population who have had their first dose of COVID-19, and we are sitting at yesterday 59.8% of the Victorian community had had their second dose, so of 16 and over. So clearly we will pass into the 60% of the double-dosed Victorian community today. We do have a few announcements to make about the support of our healthcare workforce and the supplementation of that workforce that we did want to make this morning. We know that the next few months, as Victoria opens, are going to be incredibly challenging and difficult for our nurses, our midwives, our doctors, our paramedics and in fact all of our healthcare workforce. We will see demand and challenges that our healthcare workforce has never seen before. As Victorians get back to the things they really want to do in a safe way, we will also be placing immense pressure on our healthcare workforce as they continue to care for a record number of patients in our hospitals and in our ambulance services. These Victorian frontline healthcare workers are the backbone of our COVID response, and we need to support them and recognise the support in every possible way as we help them to deliver the very best possible care when Victorians need it most. That's why today we'll be announcing a couple of things. Firstly, we're investing some $2.5 million to recruit up to 1,000 healthcare workers who are currently living overseas as part of a package designed to help to ease the pressure on our hard-working, hospital-facing staff dealing with COVID. This group will largely be made up of returning Australians who have wanted to come back in our healthcare workforce, but equally a large number of international recruits. These professional groups will cover nurses, doctors, midwives and a range of allied health care professionals, and they will be recruited on the basis of the services and support that our hospital system needs. To be eligible for this program, eligible healthcare workers need to have an existing employment contract with a Victorian healthcare service and have the active professional registration in place and to be ready to travel. This announcement builds on the work that we have done in recent weeks, having facilitated the arrival of some 130 healthcare workers under the dedicated healthcare work pathways system that we've had in place since August, and this is the next logical step in making sure that we turn back on that international pipeline of support for our hospital system that has been on hold for the past 21 months. Today we'll also be announcing a record investment of some $255 million in support of those frontline hospital COVID-facing workforces that have been not only dealing with these demands for some months, but will now, as we move into a very, very busy period, having to deal with the surge that we will see in cases in our healthcare and hospital system. We will be establishing a new allowance to better support nurses, paramedics, doctors and those hard-working people in those front-facing, hospital-based, COVID-facing environments that are really risky but really important, and as cases increase over the coming weeks, if not months, we want to make sure that a recognition of that is in place. So really, this unprecedented investment directly into those frontline carers and workforce healthcare professionals is in response to the unprecedented times that we're in. Really, the challenges that they are dealing with on all our behalf require this unprecedented response. So we will be introducing the new hospital surge support allowance, which will be paid to patient-facing healthcare workers, providing direct care in both our public hospital services and Ambulance Victoria over the next 4 months. Starting this week, the allowance will help ensure that these highly skilled staff in our public hospitals respond to the critical care that we know they will deliver, but making sure that staffing of our emergency departments is at least supported and recognised by this unprecedented investment. It's a small part of making sure that we continue to deliver world-class patient care whilst responding to the most difficult of operating circumstances that these hospital services will probably ever face. Workers in these roles will be eligible for a tiered allowance up to $60 per shift, and we see that as continuing on till the 10th of February 2022. What I might do now is perhaps invite some of our international newly arrived workforce to come forward and speak about their circumstances, how they've relocated from overseas to come and work in our frontline healthcare services. These are very talented, very skilled, hard-working doctors with us today. Firstly, we'll hear from Dr. Marcel Jagger, an anaesthetist, and Dr. Charlotte Jagger, who have relocated very recently with their family from South Africa. And then we'll hear from Dr. Laura Carter, who has recently come over from the United Kingdom. So if I could perhaps ask the Jaggers to come forward. Thank you.
Hello everyone. Thank you very much for offering us this opportunity to share some of our experiences with you, and hopefully that goes a long way to sort of support the extraordinary effort that we found that Australia and Victoria especially has been putting in against the fight against COVID. I'm Marcel. We both from, and this is my wife Charlotte, and this is our little one Rebel.
Oh, there's another one coming. She wants in.
Sorry, this is the second one of three. This is little Liv. So we specialists from Cape Town. We've come to Australia for some work opportunities. I'm interested in cardiac anaesthesia, and I've been offered a wonderful opportunity and privileged opportunity to continue that as a subspecialist in the Royal Melbourne starting next year. But we're currently working at the Northern Hospital, which seems to be at the forefront of some of the COVID outbreaks in the recent times, and we've been pleasantly surprised with how the guys have done and how well they've managed the situation thus far.
Yeah, we are very glad to see that the same drive, passion and commitment towards giving quality healthcare despite working under immense pressure is being mirrored here in Australia compared to South Africa. And I mean, the efforts are being truly heroic.
Yeah.
Any questions?
Do you guys have any questions?
Can you just talk us through what it was about coming to Melbourne to help out here that drew you to get on that plane and move the family?
Yeah. Well, so from our side, I think we've all experienced what the sort of far-reaching things are about the pandemic, and I think from our side, obviously in conjunction with the additional work opportunities, we felt that with some work expertise and experience, we can potentially help out in a system that's going into a potentially higher numbers. So we felt that it's definitely something that we can offer from an experience point of view. And also, I think as a healthcare worker, your passion is always to help people. And I think that's something that's always drived how we looked at our patient care. And I think that's always going to be at the forefront of how we look at it.
Was coming here always part of the plan, or was it a COVID-specific decision as you've seen how the pandemic's played out?
No, I think our plan was always to come to subspecialise and to work in a different environment. I think for personal growth, that's incredibly important as an individual. And I just think it worked out that we've been through a very hectic 3 waves where we've suffered losses of colleagues, friends, personally family members. So we've seen the horrific devastation of the pandemic, but we've also seen the heroics and the expertise that came with it, and how incredibly a community can pull together. And I think we come and offer a lot of experience, and also to learn from what you guys are doing. And I think Australia is very lucky in the fact that they had a little bit of buffer and time to see what was going on in the rest of the world, and to learn from experiences and to see what mistakes were made and how to improve on that. I think they're very well prepared, they're well informed, they're ready for what's to come. And we've been very impressed and very much welcomed and felt very, welcomed and supported here. It's just been a very good, positive experience.
Can you describe what it's been like to work on the front line during a pandemic, and in particular in another country, just to give Australians an example of what it's like?
Are you referring to South Africa?
Correct, yeah.
Yes, I think, it's been devastating. We've had 3 very big waves, the first and the second, and then now coming down from our third. And our healthcare system already, strained before the pandemic, was just facing another big, huge pressure. But us South Africans being very resilient, I think we tackled it head on. And, our colleagues have been incredibly brave and incredibly, well-functioning despite that.
So I think from what I've experienced, I'm incredibly proud to come from a system like that. I think despite all the sort of adversity that they've faced, my colleagues have been exceptional, and they've always put patient care at the forefront. They're exceptionally skilled and knowledgeable. But despite all the strains that came with it and all the additional things from the issues that your family members get sick and your colleagues get sick, the motivation was always to provide top quality healthcare. And I think we're quite glad to see that echoed here. So we found that very similar to what we've experienced in the forefront at Northern, is that the people are still committed to proper patient care. And it's not just from a COVID point of view, but also the patients that present with non-COVID issues. So I think there's definitely a balance about how they approach patient care. And I think that's what we applaud, so back home and here.
In terms of the pressure that the system was under that you've left behind in South Africa versus what you're seeing here in the time you've been in Australia, how are we comparing? Are we at a peak of what you've experienced back at home?
So it's always difficult to compare healthcare systems, and I think the point at which you're overwhelmed will always differ between different countries. So it's difficult to compare healthcare systems because of those pressures. But from what we've seen, to be honest, it looks like there's more excess capacity, and the people are planning for excess capacity. And that's one of the things that we've appreciated, is that there's actually pre-planning for potential numbers to increase, and there's foresight for whatever is to come. So I think they're well prepared for whatever is around the corner.
Is COVID something that either of you experienced back in South Africa as well? I know you were saying colleagues had become unwell. Have either of you been?
Yes, I mean, in the last 5 weeks, we've both lost our grandparents, we've lost uncles, we've lost colleagues. We have lots of friends that became ill, and that was a big thing. We didn't anticipate of how diminished your actual workforce would become, either being in quarantine or being ill. So that for us was really hard emotionally to deal with. You're working in PPE under incredible, difficult conditions, long hours, everyone being very dedicated, but then also, the risks that you actually, pose to your family and in your little bubble that you move into. And it was very difficult seeing the suffering. And then also, what was very hard for us was the very big threat of misinformation and social media that often went against of what we were trying to achieve and aim. It was quite insulting to us healthcare workers to see that. I think that's a global problem.
Do you think I guess it's been a little bit more reactive there, or how have you found Australia's system coming over here, our preparation and readiness to handle COVID?
So once again, we're not experts when it comes to system development or anything like that. We're just clinicians, and I think we have to sort of give the credit to the healthcare work, the planners and the policy makers. But from what we've seen, the preparedness in South Africa was actually quite good as well. I think we realised that we would probably be harder hit than somebody that could isolate themselves a bit better than the rest of the world, just because of the way the community is structured. So we actually planned quite well for managing situations like that, and I think we definitely need to give credit where credit was due. Our system was, even though it was strained, we developed policies that sort of managed the pandemic, and that seems, for the most part, actually quite well.
Yes, I'm very impressed by how well informed the management teams are here, and how well they understand the variability and the dynamicness of a pandemic. There's a big difference in managing a pandemic on the kind of up curve, then riding the wave out, and then coming down from that curve and opening up your, more elective services. And I've been very impressed at how, from day to day at the Northern, there was literally management changes made, and provided that we work with that curve and, the everyday challenges that they were faced to adapt and to, be able to adapt by this variability in this dynamic pandemic.
Would you have any recommendations for how things have been deployed overseas, or things at any?
Well, I think they have actually got more support and more resources than we had, and I think they're doing well in distributing that and the way they're managing it. But like I said, we've only been here 3 weeks. So that's our experience so far.
Marcella and Sharp, sorry.
No, you go.
Firstly, thank you for coming to help us. That's amazing. You have 3 children,
Yep.
and we've just heard from our health minister how crazy busy our health team is and is about to become even busier. How are you going to manage with 3 children? What's the game plan there?
Well, we've been used to that. We've been working double the hours we will be working here, you know, we seem to be managing. So I think we're just at this moment trying to keep our schedule so that the one can either look at the kids and the other one can be at work. And we've got incredible support here from both the Australian community that we've now been living in, as well as the ex-South African community. I mean, we've been absolutely spoiled with food being delivered, clothes, you know, strollers, and we've just been so blessed and have been so welcomed and supported. It's been mind-boggling.
And just one final question, sorry. What was the recruitment process for you? You mentioned that you've always wanted to travel overseas, but why did you end up in Melbourne? How did that come about?
Well, I think Marcel, you know, really wanted to do cardiac anaesthetics, and our options were either Toronto or the UK or here. And Australia, being very close to our culture, our weather, the way of living, we were very much attracted to family lifestyle kind of, you know, living. And we've got a lot of family and friends here, colleagues that are South Africans, and we had so many good things about Melbourne, and we've not been disappointed.
When did you get the ball rolling to actually just make the move out here, and how long are you anticipating you'll stay?
It was quite a long time coming. It took us about a year, because we both went through the specialist pathway. So we had to go through ASIM, and you had to go through your colleges and prove that, you know, we were on the same kind of level as expected specialists in Australia to be. And now currently what I think is very good is we're not just been crashing into consultant positions here. We're being eased through a process of supervised consultant, you know, teaching and supervision, so that we can get used to the new system that we are finding ourselves in, which I think is great. You know, it's a different country, it's a different system, it's a different population, and we need to kind of first familiarise ourselves with the situation.
Okay, why don't we let the Jaggers have their...
Thank you very much, guys.
Thank you.
Good job.
Thanks.
And could I ask Dr. Carter from the UK to go?
Hi, I'm Laura. I'm 33. I'm a doctor. I've come from the UK. I'm from London, but spent my working career working in Wales. So, yeah, I'm currently working in Sunshine Emergency Department in the Western Health. I've been working for 3 weeks. Came over to Melbourne and quarantined the end of August. So before moving over here, I was working in emergency medicine back in the UK. Throughout the pandemic in the UK, I've worked in multiple different roles. The start of the wave back in March, I was working in the acute medical teams, so dealing with the sick patients coming in with COVID, managing the COVID wards. I then got re-recruited back to intensive care, where I've had previous experience working because they were very short-staffed. And then spent the next couple of months working in the COVID intensive care back in the UK. And then the third wave, I rode out in the emergency department in a different hospital. So, yeah, that's really my experience. I decided to come to Melbourne because emergency medicine in Melbourne has a very high global reputation. I've come to develop my own skill set. And I've been here now for 3 weeks. Back in the UK during the waves, it's quite tough. My colleagues have already discussed about how you've had to treat colleagues, you've had to treat their family members, you've had to deal with colleague deaths, and we weren't immune from that in the UK. There were lots of resource issues in the UK in terms of when the waves were very big. Decisions had to be made about how to rationalise oxygen. Lots of fears about hospitals running out of oxygen, not having enough intensive care beds, not having enough non-invasive ventilation. all real issues that faced us back in the UK during the waves, and it's quite difficult to get that across to people who haven't experienced it. And I understand that the numbers in Victoria are rising, are increasing. And I really hope that the way that Australia have handled the pandemic, the buffer they've given, the experience they can learn from the rest of the world, the vaccine is really going to help manage that to the point where we're not going to get to where we've experienced globally. So, yeah.
Laura, thank you for coming. To go through what you have just been through in the UK and now what you know is coming, I don't expect you to comment on the politics at all about whether we should be opening up at 80 or 90%, but because you have experienced things opening up, a population being largely vaccinated, are you concerned that numbers are going to rise, or how safe it is that we are going to open up? Or you think that that's a feasible option, just in terms of what it would mean for a hospital and the numbers?
I mean, I can comment on my experience. So I've worked in Sunshine ED now for 3 weeks. When I started, we had no COVID cases. We're now seeing daily COVID cases and sick COVID cases, mostly in the unvaccinated. But it's definitely a throwback to the beginning of the wave the first time. I can't comment. All I can comment is that when people get together, the virus spreads more. When to open up and amount of population vaccinated, I'm not an expert. Can't really comment. It's a global problem, balancing human life and economics. But currently, all I can say is at the moment, in even just the 3 weeks that I've been working, I've seen the numbers increase quite rapidly.
We're talking today, obviously, about drawing on workers from overseas to bolster our workforce. How did you find the process to come and be able to come out here and work? Has it been a long time coming? Was it straightforward for you? It was quite an impulsive decision for me to come out. I've come out with my wife. I got a job in March, and all the paperwork came through mid-July. The need, once that was through, then actually physically getting into the country was quite arduous. And actually, the Victorian government helped that process to get us into the country to quarantine. So that was extremely helpful. And that was on the basis of us needing extra expertise. Critical care skill shortage.
Are you able to describe to people the difference of what it's like responding to the UK responding to COVID in the UK hospital system versus Australia? I've lived there myself for a while, and I know that just seeing that those case numbers they're shocking, they're frightening. So could you just describe the difference?
So I've been very impressed I can only comment on the department that I've been working in, and I've been very impressed about the adaptability of the department. Even since I've been there for 3 weeks, we are daily making changes to cope with anticipated workforce requirements. We last week opened up a new floor to the emergency department to help not only separate people with COVID, non-COVID, but to expand and create more space for the anticipated illness that's going to come. So that's been very impressive. The dynamic changing. There's a higher level of staff in here, which is really helpful and appreciated and needed.
In terms of the worst of what you saw from where you've come from versus what you're seeing now in the last 3 weeks, how do the two compare? Obviously, here in Victoria, seeing the numbers go up, there is definite concern and panic in the community about that. Can you just give us some context about where we sort of stand on a global scale?
I think it's difficult to say, but a person who's very sick from COVID, no matter how many of them there are, is a really horrible experience to go through for anyone. And it's similar to the UK in terms of what I found so far the last couple of weeks is it runs through families. It's very hard to see whole family units ripped apart by COVID. And I think that it doesn't discriminate who you are, where you are in the UK. That it will just spread. And I think Melbourne and Victoria and Australia have actually, the way they've prioritised human life with the lockdowns over economics is actually quite inspiring, and they've put themselves into a really good position where you now have the vaccine, you now have a way to help cope with what potentially could be high surge, and the uptake's been fantastic, and I really encourage people to keep doing it. It's the best thing you can do for your community.
The example you used before, where there was talk of having to ration oxygen overseas, do you see anything even within that scale here from what you've seen in the last 3 weeks?
So I haven't seen it yet, no.
And do you feel as though we're a fair distance from that? Again, just trying to get that context of where we're standing versus what you've seen elsewhere.
I think it's hard to answer. In terms of in A&E and what I'm seeing coming through the A&E, I'm not entirely sure what's going on in the critical care levels. Is the numbers are increasing, and they're increasing quickly.
But overall, do you think that Australia's taken a more proactive approach from what you've seen in the UK? Do you think opening up with higher case numbers over there strain on the hospital system?
I think Australia has been very pragmatic, and I think the amount of vaccinated people and the lockdowns has massively helped curb the healthcare pressure so far.
Thank you so much for talking to us. Really
Thanks,
appreciate
Doctor.
And welcome.
Thanks.
Thank you. Brett.
Thanks, Minister, and thanks, Laura and the Jaggers, for your reflections, really powerful reflections, and we do appreciate all the support you're going to give to the COVID response and other responses in your specialist areas ongoing. I do think there are very powerful lessons, one about the scale of human suffering globally and really how Australia has done well to protect itself from just how awful it could have been here. There are close to 5 million confirmed COVID deaths globally. The true figure is probably closer to 10 million, if not above that. And, close to 150,000 deaths in the UK, although a much bigger country, is still pretty staggering when you think about how that affects both the healthcare system but society overall. For the picture of COVID in Victoria, we do see a bit of a drop in numbers over the last few days. I think most people feel cautiously optimistic about that. I'm cautiously optimistic about that. I think it's terrific to have seen a consistent drop over a few days. That's not to say that we shouldn't keep our guard up or that we might not see an uptick in cases, but with the higher and higher levels of vaccination coverage each and every day in Victoria, across Australia, it does give me hope that we are continuing to suppress the transmission in our hotspot areas in particular, as vaccination coverage has really improved, but really across the board. Yesterday in the northern suburbs we did see 527 new cases, again mostly in Hume and Whittlesea. In the southeastern suburbs there were 363 cases. That's increasing a little bit, but much more stable, mostly in Casey. We do have a new mass testing site in Thompson's Road in Cranbourne, and they did almost 900 tests yesterday, which was great for a first day. But it can do double that number, so if you require a test, it's a great option to get through and get a test quickly. The western suburbs saw 387 new cases, which was about a quarter of the total, and the eastern suburbs 69 new cases. For our regions, there are 110 new cases. That's pretty stable again. There are now 1,144 cases outside of Melbourne. Greater Shepparton, Greater Geelong, Greater Bendigo, and of course Mildura, which is currently in lockdown. There were 24 new cases there. For Mildura, that's a total of 113 active cases. But there were 900 tests done yesterday. That's 3,300 tests since Saturday. That's about 1 in 10 people in Mildura have been tested just in the last few days. So a fantastic community response in Mildura, and indeed an online community forum held last night had 2,500 people in attendance. So again, almost 1 in 10 people tuning in to see what the update is there and what they can do to help their community and to make sure they stay on top of transmission. To good news, vaccinations, our weekly local government area data summary, Mildura had the highest growth in first dose vaccination coverage of anywhere in Victoria in the past week. It's now tipped over 90% for the over 16 population getting a first dose. There are lots of other local government areas that are doing really well after Mildura. Latrobe, Bor Bor, Mitchell Shire, Hume, Casey, Melton and Greater Dandenong. So a lot of those you're familiar with as hotspot areas. So absolutely fantastic to see that really significant growth in first dose coverage. And others in regional Victoria that have seen cases or haven't seen cases, but really important that regional Victoria thinks about getting vaccinated. There are places in regional Victoria that have seen very few cases or for some no cases at all for several weeks or months. But we are going to be moving about the state at the 80% double dose mark, which will come in early November. So regional Victorians, don't put off vaccination because you haven't seen COVID in your community. You need that first dose, the second dose following 3 to 4 weeks later, and another week or so to get the immunity to really kick in with that second dose. So please, if you've had no dose at all now, please make sure you get that first dose because COVID will come to all regions of Victoria in time as we open up. Hopefully with the kind of stable, low levels that we're seeing in regional Victoria now because we've got that very high vaccination coverage. It has been really encouraging to see communities come forward for vaccination. It really will be that cap on transmission that we need across the state as we open up. We've got more than half of our local government areas with 90% first dose coverage, and more of those LGAs are tipping above the 90% coverage each and every day. There's 46 out of 79 LGAs that have achieved this milestone, which is absolutely fantastic. In support of that, we've got school pop-ups continuing to drive our vaccination rates, especially in that 12 to 15-year age group, which has absolutely skyrocketed. There are 11 school vaccination pop-ups this weekend. There are new ones running at, and I'll go through the list, Thomastown Secondary College, Luana College in Newborough in the Latrobe Valley, Carrum Downs Secondary College, Pakenham Secondary College, Tarneet Secondary College or Senior College, Glen Eagles Secondary College in Endeavour Hills, St Albans Secondary College, Elevation Secondary College in Craigieburn, the Lakes College in South Morang, Coburg High School and Chaffey Secondary College in Mildura. So these pop-ups are open to school communities, obviously, but they are also open to anyone in the local area. So please use those pop-ups as an opportunity to get vaccinated, especially as kids return to school. If you are a household with kids going to school now or going to school very soon, please get vaccinated because there will be COVID-19 that is brought back into households from school cases, and we want that cocoon of protection within households as schools open up more fully. These pop-ups are administering Pfizer and AstraZeneca, with the exception of Luana College in Newborough, which has Moderna and AstraZeneca available. Some are taking bookings, but all of them will accept walk-ups with no appointment. So it's a terrific opportunity to get vaccinated close to home in a setting that's familiar to those who are attending. Thank you.
Thanks, Brett, and can I thank our international doctors for their contribution and the important work they'll do on behalf of all Victorians. Happy to take questions.
Minister, we're hearing reports that the government has restricted surgery to urgent cases, Category 1 and 2 from Thursday. Are you aware of that?
Yes, as we've made clear all the way along the line, as cases increase, as COVID cases increase, we've foreshadowed that we will be shifting capacity from the state sector to the private sector, and with that, as the streaming hospitals increase in number, that we will be progressively seeking to switch off elements of non-urgent care. We regret that that decision has to be made. Unlike in 2020 when we switched it all off in one go, what we've been doing in 2021 is progressively moving that capacity shift along. This is an unfortunate but necessary measure to take account of the increased demand and the increased space and the increased workforce demands, and we can't rule out further changes.
Can you explain to us then what that change is, exactly what surgeries won't go ahead and where?
So all urgent Category 1 and Category 2A surgeries will continue, and what we will see, depending on the location and the particular arrangements between the local public and private hospitals, is different arrangements in elective surgery being rescheduled. There won't be one single blanket-wide state approach. It will apply differently in the regions, and it will apply differently depending where the levels of demand are on those public healthcare systems. But essentially, the partnership that we have in place with the private sector will see an increasing number of non-elective surgeries rescheduled and an increasing number of public critical care cases for ongoing medical and surgical support relocated from the public sector to the private sector.
So there will be certain categories that will be put on hold, or it will be assessed on a case-by-case basis?
It'll be clinical decisions depending on what those particular areas are, but essentially all non-urgent Category 1 and Category 2A protected, but other categories of clinical care will be rescheduled on a case-by-case basis depending on particular circumstances in particular locations.
As those extra cases end up in the private sector, do these new support measures for patient-facing healthcare workers apply to those who work in the private sector as well? So
the new arrangements that we have in place are for COVID-facing patients. The COVID-facing arrangements will be in the public sector.
So you must be dealing with a COVID patient, not just any patient?
Correct. You have public hospital or Ambers Victoria COVID-facing arrangements, and they also graduate across the public hospital system, where you'll have red zones and amber zones, and depending which zone you work in, there's a tiered allowance that follows that exposure risk.
Minister, on the recruitment of these overseas healthcare workers, why not do this earlier when we've known for months that we were going to reach this?
Well, we have been doing it. We've brought in over 130 people already. In regards to the whole international pipeline, year on year, the Victorian public healthcare system averages around 700 to 800 international recruits in pre-COVID times. Those international borders were snapped shut in 2020, and we've worked cooperatively with our healthcare professionals, the colleges and the Commonwealth to reinstate that. So we think this is a timely contribution.
So are you saying it was quarantine problems that made it hard to bring them in?
No. As we've seen workforce demands, we've been able to project in terms of planning where these peak workforce demands are going to be. We've had pipelines turned off for 21 months now. We've gradually turned those on again since August, as the doctors are testimony to, but we will now be substantially ramping that up. 60% of the 1,000 people that are coming in between November and March will be returning Australians, and 40% will be clinicians, nurses, allied health professionals from the international community.
So just to confirm the numbers, so we were at 800 external international recruits pre-COVID, and now it's 1,000. So essentially, it's just getting back to that pre-COVID.
It varied year on year, but it was between 700 to 800 a year. And what we are now doing is, after having that pipeline turned off for a period of time, now having to switch it back on in a timely manner to take account of what is going to be an extraordinarily challenging time for our healthcare system, and we need those professionals registered, accredited and ready to hit the ground as soon as they show up into our public healthcare system.
As we just heard from these staff, though, we've got one that's been a year in the making that they've been able to get out here, the other it's several months. So how quickly can we get someone here from overseas to help with what we're dealing with right now?
So this has been some time in the making. The arrangements we have in place, those 1,000 workers are already contracted to different public healthcare services across the state, and those scheduled arrangements for both quarantine purposes and for stepping up on the ground at healthcare services are scheduled over the period from November to March. So these are turned on pipelines that both returning Australians and international clinicians, nurses and allied health professionals will be stepping into over the next few months.
Is it realistic that they would be working when we reach that hospital peak that we are forecasting in the coming weeks, or will they be here to help at the tail end when our staff are exhausted?
Well, clearly, as the Burnett modelling showed, we could expect the peaks in cases between now and Christmas, and as this process starts next month, a substantial number of those workers will be coming here as we hit that peak. Equally, we will need, coming off that peak, further workers to both supplement our already fatigued hospital workforce, and they'll also play an important role in the ongoing response to COVID, which isn't going away come 2022.
It looks like we might meet that 70% double dose target a little bit earlier. Is the government looking at any greater freedoms for Victorians once we reach that point? Sorry.
So I welcome the enthusiasm in which Victorians are stepping up to be both first and second dosed for the COVID vaccine. It's our ticket out of this pandemic. In regards to the roadmap, we've got nothing to add to the roadmap. It's transparent. We'll go through that process. The first milestone is 70% double dosed of 16 years and older. The second gateway is the 80%, and I urge all Victorians to come forward, get those first and second double doses, and get us into a position where we can open up carefully and safely.
Can I just ask Brett, just on that, in terms of the reopening, 70% double dose, is the reopening tied to that milestone? Will it happen when we hit that milestone, or is it tied to that date of October 26?
Oh, no, there's some flexibility depending on how quickly we move to it, but we do need to get at or around that 70% double dose mark. That's clearly a threshold that the modelling has suggested you can have some moderate easing. But if we move there faster, there's obviously consideration of having public health directions kick in a little bit earlier, potentially.
And what are the forecasts saying now? So some are saying that we might get there before next weekend. Is that what you're thinking too? Is it possible that we could...
It's possible we're 3 or 4 days ahead of that original forecast, but as I've said all along, it kind of depends each and every day on those bookings getting fulfilled and people stepping up and getting that vaccine. There are some days where it drops off. There are obviously some weekends where the primary care and pharmacy numbers are not as great, but the state system's been absolutely powering through in terms of daily vaccinations being given in the 30,000 - 40,000 range. So I think that's reasonably well guaranteed, but there are good and bad weather days, there are public holidays that can make a difference to some of those interim measures.
70% obviously brings us a number of new freedoms, but it still doesn't allow anyone in your home. But at 80%, you go straight up to 10 people. Is there any flexibility that you would look to have, whether it be 2 or 5, as we've done previously, to be allowed to have people in your home? That's what lots of people are desperate for.
Yeah, look, there are always considerations as we move through and have a look at the epidemiology every day. As I said, it's possible that we're in a plateau or that we're now on the downslope. It would be great to be at much lower numbers when we get to that 70% double dose mark, and we can look and review that as we progress towards that. We don't want any restrictions to be in place that aren't appropriately precautionary, but also that don't impose constraints that aren't required. We know that household transmission is a really significant driver, and one of the elements we know will open up at the 70% mark is that you can move further away from your home, and there will be opportunities to see family and friends outside. So I hope that's a recognition of the need for us to see loved ones and family members, but I'm not saying it's excluding the possibility of in-home visits, but it's not part of our current roadmap. Can
you explain why you made the call then to go from nothing to 10? Why that's a much bigger jump than we've seen previously?
Look, it's really a significant milestone to get 80% double dose coverage, and again, we are powering through our second doses. It makes a huge difference to have, instead of 30% of your eligible population not fully vaccinated, down to 20%, and then to see that tick up by almost 1% every day. So, I think we want to be in a safe zone when that happens, but getting into that zone is a really different kind of ball game in terms of the protections that we have.
How close do we need to be to that date of hitting the milestone before you have confidence in the projections? Is it you're going to wait till the day before, or is it 2 or 3 days before?
Look, I'm not 100% sure. The modelling has its own uncertainties, so being absolutely fixated on 69.5% or 70.5% is one thing, and the same for dates. Around that time, we know that we can make some moderate and precautionary steps, and then to see how things progress in that interim period. All of it, remains under review all of the time. But I don't think that, nothing is critically linked to a specific single figure. The modelling's got its own uncertainty in that regard.
Can I just get your take on today's case numbers, given that they have dipped from that almost hitting 2,000 mark, so we've gone on a bit of a downward trend? So do you think we've hit this peak of the pandemic, or is it...
Look, I think so, but I would say, I'm cautiously optimistic like many people. It's not definitive. We can see numbers bounce around, and we can see behavioural changes change the numbers a few days later. We did see that bump, and it was indeed related to family gatherings, but that seems to have settled down, and to have 4 days in a row of decreasing numbers is a good trend, but it's not definitive, and there are still projections that the effective reproduction number, that REF, is at or around 1. So it'd be good to see that settle down to 0.7, 0.8, where we can have real confidence that we're going to see lower and lower numbers day by day.
In terms of the relationship between the case numbers and the number of hospitalisations, is that travelling as you predicted? Some are saying it's lower than perhaps what was seen interstate.
So the case numbers have been at or around the modelling, maybe on the high side, again because of that bump in cases in the last couple of weeks. The hospitalisation is a little bit under modelling predictions, and maybe that's because it undercalled really how protective that single dose, that first dose coverage was, which Victoria really pushed, and I think was the right strategy. There were plenty of calls for that interval to come back down from 6 weeks to 3 weeks. We didn't have the supply. We wanted that first dose coverage to be really substantial and really pushed until we had a supply that allowed for that second dose. So that really high first dose coverage, I think, has protected our hospital system in terms of the line for hospitalised cases and the line for confirmed cases have diverged significantly, but we've still got a peak to come in our overall hospitalisation. It's 2 or 3 weeks away. If the peak in our confirmed cases is now past, then we can expect that the peak in our hospitalised cases might be 2 or 3 weeks from now, and hopefully going into November it's easing off, but it won't magically disappear. People who need COVID care require it for several days as hospitalised cases and potentially weeks in ICU.
Do you see that peak lining up with the with school returning? Is that essentially the same timing?
So look, there's a staggered return for school, and obviously we've got regional schools going back now. We've got some GAT students going through, and there's VCE to run through. So there's a staggered return to school, but the full return to school is going to happen at a time where there are still significant cases in the community. That's why I'm really emphasising families, eligible kids all need to get vaccinated as soon as they possibly can to protect schools, to make sure that those classes go ahead and that cases aren't introduced into the classroom, but also for all of the cases that will occur in some of the families with positive school kids. We've got layered protections, multiple layered protections in school to minimise that transmission. But one of those layers of protection is absolutely the vaccination of kids and the vaccination of those families.
Speaking of case, there's a bit of concern about Halloween and what you're allowed to do when that does come around. What's your advice?
Look, it'll be in line with the roadmap limits for gatherings outside. People, I think, will do the sensible thing. They'll understand how many active cases are out there in the community. We're at thousands now. There'll be hundreds of people who aren't aware that they're COVID positive, who might be out and about at the end of October for Halloween. So people need to stay within those limits, and they need to wear masks, and they need to keep their distance. But, you know, families will want to enjoy Halloween. My family's going to have kind of a Halloween at home where there'll be dress-ups and there'll be a kind of Halloween hunt in the backyard. So people can and should enjoy it, and it's not to say that they can't visit along the street, but we want people not to gather with other family members to the extent possible. Again, staying within those gathering limits for fully vaccinated adults that will be in place for the roadmap.
What are your main concerns about the southeast and the city of Casey? And Dandenong High looks like there might be about a dozen cases out there as well.
Yeah, so it's been a growth in the southeast. Again, they had some catch-up to do in terms of vaccination coverage. They have cracked on like lots of other places, and Greater Dandenong, Frankston, Casey, Cardinia, all really kicking off with first and second dose vaccination coverage now, but they're not all at that 50+% double dose mark, and that's really critical, and you've got to go beyond that, obviously, because that's when we start to see the plateauing of cases. So you know, it's really just to reinforce we've got all of those protective measures around the rules, the public health directions. They need to be in place in people's minds as much as vaccination. That's not the only protection that's available, and people need to try and get tested if they're symptomatic. Whether or not they're vaccinated, they need to also limit their interactions with other people to the fullest extent. I think it'll stabilise in coming days, but it's been a growth area because of that low vaccination coverage.
What more will be done to boost vaccination rates in Casey? Is there a more intensive campaign needed like in Hume?
Yeah, look, it's been ongoing. There's been online engagement. There's been bicultural workers, lots of work to bring vaccination to those populations. So there's lots of promotion work going on. But that'll be ongoing, and it's clear and appropriate that our vaccination program is now going to those kind of micro pop-ups, end of the street vaccination, school-based vaccination. So we are bringing the vaccine to populations who may not have accessed it to this point in time for whatever reason. Sometimes it's hesitancy, but sometimes it's around the availability and the prominence of vaccination. So we're making it accessible, and we're absolutely promoting it down to that micro level.
So there's a month gap between the roadmap later this month and the vax mandate on November 26th next month. Will unvaccinated and partially vaccinated workers, for example, hospitality workers, be allowed to work in that month period, given that patrons will need to be fully vaccinated?
Look, those existing mandates are for our authorised workers, for our essential workforce, but for the vaccinated settings, those public health directions are not written yet, and there should be an expectation that everyone who's attending, including staff, will require vaccination. That's been laid out in the roadmap, and that would be my expectation. But those public health directions are not in place as yet.
So unvaccinated Victorians, just to follow on to that, in public-facing jobs won't be able to return to their place of work.
As I say, those public health directions will be written at the time, and all of the reviews, including the charter considerations, are made at that time. But my expectation would be that those are fully vaccinated settings for staff and patrons.
A lot of ambiguity around it currently. And just also on the vaccine passport trial, a lot of businesses are starting to get a bit of pushback from patrons. So there's one in particular in Warrnambool, fielding calls from vaccinated haters. So what's your advice on how businesses can better manage?
Look, the trial in part is to see exactly how this goes. The message is clear. We want settings to open up safely, and the increased caps for those settings, absolutely, because there's an expectation that fully vaccinated individuals will be the ones attending. That makes it safer, and it makes it much more able to have a bigger patron cap in those settings. I think businesses want that increased patron cap, and I think they'll want to do whatever they can to ensure that there's compliance so that they can safely operate with those greater caps. There'll be some tensions, but let's see how the trial plays out in terms of how compliance and enforcement works in those settings, and the ease with which those vaccine passports or vaccine certificates work in those settings.
Apologies if this has already been addressed. We've just got a question from our friends in Geelong. Apparently Geelong's double vaccination rate was 69.2% as of Sunday. Will those regional areas that have reached the 70% double dose targets ahead of that October deadline be granted additional freedoms earlier?
No. The plan for the roadmap is statewide, and it's really difficult to pick off individual local government areas. People would make the claim, for a patchwork of LGAs within metropolitan Melbourne on that basis. So we are looking to that statewide average. But again, I'm calling out for every local government area that doesn't have that higher vaccination coverage, there'll be movement of people through your LGAs into regional Victoria and across Melbourne, more so as time goes by. And so everyone needs to consider what that means for their personal risk, but also for their community safety.
Sorry, Racing Victoria says they're in negotiations to bring in New South Wales jockeys for the Spring Racing Carnival. What's the scientific basis for why we wouldn't let in people from New South Wales, considering their higher vaccination rates and lower infection numbers? I haven't
even been briefed on that issue, so no decision made in that regard. Of course, they're wanting to bring in potential staff to have a significant event take place, but that'll be considered in a proportionate way along with all of those other cases. But we're prioritising the compassionate cases for exemptions at the moment. It's clear that with the downgrading of much of regional New South Wales to orange, and ACT and Greater Sydney and other lockdown areas of regional New South Wales to red, that there's that ability for Victorians to return. But we are going through changes to the exemptions process and the permit process more broadly to try and open up the ability for people to move from New South Wales. But I haven't even been briefed on a particular issue around a workforce. They'll be considered in line with all of those other cases, not given a special priority or a greater priority amongst others.
Where are you at, and what are your thoughts on reducing quarantine for interstate travellers from 14 to 7 days? It seemed like it was flagged 2 or 3 weeks ago, but there hasn't been much spoken about it since. Is that something you can see happening soon?
Still under consideration. Yeah, I think it'll happen in the fullness of time. Exactly when it happens, we have to balance it against all of the proportionate measures for international arrivals, for those who are quarantining as close contacts or household contacts of cases in Victoria, as well as anyone coming in from other jurisdictions. But it's clear that as we get to a higher total population vaccine coverage, that a shorter quarantine period is potentially more proportionate. So absolutely on the radar.
Let's clarify one more point, Minister.
Yes.
Minister, just on our earlier
question time ensued.
Just a really quick one, just on our early discussion about elective surgeries, are you aware of more changes coming later this week?
Later this week, yes, as I indicated to your earlier question, we're stepping through those processes as we forecast increase COVID cases in our public health system. We need to create the space, we need to create the workforce to deal with them. That requires, in part, our collaboration with the private hospitals, and we will be both switching off some non-urgent elective surgery as well as transferring both some elective surgery and some urgent surgery. It will vary in location to location because of case numbers and particular circumstances, but we want to make sure that those critical urgent surgeries are done regardless of the setting, public or private. And I want to thank the private hospital sector for coming forward and being partners in that. And I also want to apologise to those people in advance who will see their elective surgery rescheduled. That is an unfortunate result of the COVID crisis. The clinical decisions about prioritising the sickest people getting the most urgent care necessitate that. That's the principle on which our clinical arrangements right across the board are dealt with. And as we see those COVID cases increase, those critical cases will be COVID cases.
So people with surgeries planned later this week, next week, can they expect to be contacted by hospitals?
Yeah, of course. Work on the basis that until such time as you are contacted, that your scheduled care will continue, but we can't rule out that non-urgent, non-Category 1 and Category 2A conditions won't be rescheduled. It won't be uniform like it was in 2020 where we just switched the whole lot off. We've learned a lot. We've learned the capacity to be able to manage the system in a more nuanced way. And I want to thank the private sector. I want to thank all the various professional colleges and, more importantly, our frontline healthcare workers in both the public and private sector for the way in which the recognition of those people who are most critically in need, being our COVID increasing number of patients, need to take priority.
Minister, Luke Allen has just resigned on day one of the IBAC hearings. What do you make of this decision, and are you concerned that other MPs might step down as a result of branch stacking?
Well, I wish Luke and his family all the best. He was a valued colleague in the ministry. I worked very closely with him on the National Disability Insurance Scheme, the vaccination rollout of the private aged care system and a range of other measures. He's made his decision based on his particular circumstances. In regards to the ongoing role that IBAC hearings, which will run for some time, as I indicated yesterday, it would not be appropriate for me to run a commentary on a live IBAC process, and I won't be.
Have you ever paid for the membership fees for anyone to join the Labor Party?
No, only myself. All good? Thanks, everyone. Have a good day.
Sorry, like you mentioned over. How far into you? 25 ways. Yeah, it's so funny. I'm so bad at maths. I remember television saying, and she was like, this happens at halfway. I'm like, oh, okay, yeah. Thanks. You passed it, girlfriend. You missed it. You missed it. You were there, but you missed it. Have you? I'm so talking. I just had to be now. I missed it. Fine.